Good morning, guys. Welcome to Keep Calm NS on YouTube channel with me, Cindy. So, in today's presentation, we are going to revise a past paper question on asthma. So, if you are not yet part of the family, go ahead and subscribe, like, and share the video. So, for the introduction part, it is important for us to remember that asthma is a condition in which a person's airway becomes inflamed, narrow, swell, and produce extra mucus, which makes it difficult to breathe. So, as you can see from this picture, we are able to see the respiratory system, which is the airway, the system whose function is to ensure that there is exchange of gases of oxygen between the environment and the body cells. And this airway is what becomes inflamed, become narrowed, and there is production of excessive mucus, which makes it difficult to breathe in. So this is what asthma is about. So let's get on to the question. Let's look at the question, then we'll proceed to answer this question. So the question was saying, Mrs. Mulenga, who is married to a police officer, is a well-known asthmatic patient. She was admitted to your ward in severe asthmatic attack after spraying her garden with a chemicals. So note from the question that this is a non-asthmatic patient. Then she had an asthmatic attack after spraying her garden with a chemical. So part A of the question was saying, define asthma. Then B, list 5 clinical features that Mrs. Mulenga will present with, which will show that she has severe asthmatic attack. Then C, describe her management from admission to discharge. Then E, state 5 points you include in your IEC to Mrs. Mulenga. Then the D part states that Mrs. Mulenga will use a nebulizer, so you have to explain how you assist the patient to use a nebulizer and state your role as a nurse. Then E, state the 5 points you include in your IEC to Mrs. Mulenga. So the E, okay. There is that repetition of the question, but we'll look at it just like that. So let's now go to the answers. So these are the answers. So the definition, how can we define asthma? Well, asthma is a common chronic inflammatory condition of the airways in which is characterized by bronchospasms, severe dyspnea, wheezing, chest tightness, and expiratory exhaustion. So in other words, we can define asthma as a condition that affects the respiratory system in which there is chronic inflammation of the airways, which is characterized by bronchospasms, severe dyspnea, wheezing, chest tightness, and expiratory exhaustion. So that is how we can define asthma, and when you do that, my friend, you can get your 5 marks that you deserve. So remember that when you are defining a condition, you have to mention the system that it affects, then the causes and the signs and symptoms, right? So the B part of the question was saying, state the clinical features of severe asthmatic attack. So we are going to list the question was saying we should list the clinical features which are going to show that this patient is in severe asthmatic attack. So these are some of the signs and symptoms of severe asthmatic attack. 1, increasing wheezing and breathlessness. So a patient will have wheezing, will be having wheezing sounds, and they will be breathless. Then respiratory rate will be higher or less than 25 breaths per minute. So in most situations, the patient will be breathing very fast because they are having difficulties in taking in much or enough air that the body is required to have. So as a result, the patient will be trying to breathe as fast as possible. In the end, they'll have fast respirations. So the heart rate will be persistently high or more or less than 10 beats per minute. So there will also be cyanosis. So cyanosis, this is the blue correlation of the skin due to reduced oxygen levels in the body, and this is evident on the nail beds, the lips, yes. So that is cyanosis. Then there is also bradycardia. So bradycardia, this is a reduced pulse rate. Then the person may also be in confusion due to the reduced levels of oxygen in the blood, especially in the brain. Then there is also unconsciousness. So unconsciousness will come about in severe asthmatic attack due to reduced oxygen levels in the blood. So these are some of the signs and symptoms of severe asthmatic attack. So the most predominant one is that the patient will have severe difficulties in breathing, reduced oxygen saturation levels, they may be cyanotic, also they'll have labored breathing, then they'll also have fast respirations and bradycardia. So those are some of the signs and symptoms of asthma. So now there is also okay, we still have some more. So there's difficulties in breathing, which we talked about, and this shortness of breath and chest tightness. So because the respiratory system is inflamed, the airways are inflamed, the airway has become narrowed such that very little air is able to go into a patient's body. As a result, a patient will have shortness of breath. So now, the C part of the question was saying, state the management from the time of admission to the time of discharge. So we are going to look at medical management and the specific nursing care that has to be given to Mrs. Mulenga, who is our asthmatic patient in this case. So let's look at the aims of our management. So the aim of our management, 1, is to improve pulmonary function. Second, to quickly reverse bronchospasms. Remember that bronchospasms are coming about due to the inflammatory reaction or process which is occurring in the airways, which is in the respiratory system. Then also we want to make sure that we treat bronchial edema. Remember that when there is inflammation, anywhere in any part of the body there will be edema because there is increase of blood flow and the inflammatory chemicals to that part of the body, which is also the same when it comes to in the respiratory system. So because there is inflammation, there is increased blood to the affected area, and so it will result in edema, and edema will also cause reduced surface area for gaseous exchange. So this is why we need to treat this bronchial edema so that the patient is relieved from difficulties in breathing, fast respirations, and labored breathing. Right. Then we also want to treat any core existing infection. So if the patient is asthmatic, is a non-asthmatic patient, they may also have existing infections. So we want to make sure that we also treat those other infections which are present. Yes. So these are our aims of management of a patient with asthma. So now let's go on to look at the medical management. So under medical management, we are going to start with the investigations. So under investigations, the first thing that we are going to do is we're going to take a history taking, which will review that this patient is a non-asthmatic patient. Then we also do physical assessment, physical examination. That's when you'll be able to see the signs and symptoms that the patient is having. Then arterial blood gas analysis. This will show us how much oxygen in carbon dioxide that the patient is having, and in this case, this patient will have low oxygen levels and high carbon dioxide levels. Then also pulmonary function test. We want to see how effective is the pulmonary system working for the patient. Then we also do an X-ray, chest X-ray, which will review that there is inflammation in the respiratory system, in the bronchioles, in the airways. So these are some of the investigations that we are going to do for our patients. When it comes to treatment, we are going to make sure that we nurse our patient in a right up position, propped up position, or like yes, in a right up position. This is in order to facilitate full lung expansion, which will help in increasing the amount of oxygen the patient is taking. Then we are also going to administer oxygen, especially that this patient is likely to have low oxygen levels, and because they are having difficulties in breathing, we are going to administer oxygen to help increase oxygen intake. Then also we are going to administer intravenous fluids if there is evidence of dehydration, or if the doctor has prescribed intravenous fluids, we are going to administer them accordingly. So when it comes to medications, bronchodilators are the most useful drugs in asthmatic patients. So the bronchodilators such as Ventolin puffs or a nebulizer is going to be used. Then aminophylline IV, aminophylline intravenously can be used also, 250 milligram as a bolus, or 750 milligrams infused in normal saline to run in 8 or 12 hours. So this simply means that according to what the doctor has ordered, we are going to give a bolus of 250 milligrams of aminophylline IV, or we are going to give 750 milligrams of aminophylline, which is infused in normal saline to run in 8 or 12 hours. Then other medication, other drugs that are going to be given are anti-inflammatory steroids, are also going to be administered, such as dexamethasone, prednisolone, also adrenaline also can be given, also and hydrocortisone can be given. So the anti-inflammatory drugs are very, very much important for a patient with asthma, because we want to reduce, or we want to stop the inflammatory process which is occurring in the airway. As a result, a patient will be relieved. So we are also going to treat any coexisting infections, especially if sputum for culture and sensitivity was collected and it has become positive to a certain microbacteria, we are going to also treat that infection. So any culture which was done, maybe blood culture, or if, as long as there is evidence of the presence of infection, we are going to treat that infection accordingly with use of antibiotics or according to the doctor's orders. So different antibiotics can be used, such as ampicillin, benzylpenicillin, amoxicillin, etc., etc. Then also anxiolytics may also be given to allay anxiety, such as Valium 5 to 10 milligram orally is also given to relieve anxiety. So because when a patient is in an asthmatic attack, they are fighting for air, they're having difficulties in breathing, they may become very worried and very anxious, which will even worsen the condition more. So it is important that the anxiolytics are given to allay anxiety. So now let's move on to look at the nursing care that you are going to give to Mrs. Mulenga, who is our patient at this particular time. So it is important to notice that an asthmatic attack is very frightening, like we said earlier. So a patient is very frightened, they are very anxious. So the patient will be fighting for breath and is often in panic stricken. So the patient is also panicking. Therefore, as a nurse, it is important to maintain a calm and reassuring manner. So as you are attending to this patient, you have to make sure that as a nurse or as a doctor, as whoever you are attending to this patient, you are calm so that the patient is not also panicking, because when you show that you are also worried, you are also panicking about this patient, it will make the condition worse. So remember, this is why this channel is here, to help you learn how to keep calm and nurse on. So let's move on. So first of all, we are going to start with the environment. What type of environment are we going to nurse our patient in? So we are going to make sure that we nurse our patient in acute bay for close monitoring. This simply means that we are going to nurse this patient very near to where the nurses are, or it can also be in an ICU if the condition is very critical. The patient will be nursed in an ICU. Now, if it's just in a medical ward or in an outpatient department, the patient is going to be nursed in an acute bay to ensure close monitoring. So if you are writing your essay in an exam, remember that you have to include yourself by saying, I will nurse the patient in an acute bay for close monitoring. Then we want to make sure that the room should be well lit by switching on the lights if it's at night for clear and easy monitoring. So we can't nurse a patient in the dark room, right? So if it is in the night, we are going to switch on the lights, and if it's during the day, we are going to draw away the curtains to allow enough light to enter into the room. So we also want to make sure that the room should be warm enough to prevent hypothermia, which can worsen the condition. This can be achieved by switching on the heater, closing nearby windows, and covering the patient with extra linen. So we want to prevent hypothermia because it can worsen the condition. For that reason, we are going to make sure that we provide a heater in the patient's room or close the nearby windows and give the patient extra linen so that we prevent hypothermia. So also we are going to make sure that the vital signs tray is within the room for quick access. So the vital signs tray, or maybe if there is a cardiac monitor, the patient should be connected to the cardiac monitor for easy monitoring. Then the patient is also nursed in a well ventilated unit. So this is achieved by opening windows. Then she should be nursed in an upright position, supported by pillows and a backrest, or lean forward an overhead table. So we are doing this to facilitate the full the expansion of the lungs to be full so that enough oxygen is taken in by the patient. So next, the nurse should be on alert for signs of impending respiratory failure. The patient appears restless, confused, increase in respiratory rate with labored breathing and use of um, accessory respiratory muscles. So as a nurse, you have to be alert for anything abnormal that can happen to our patients. Then also remove any material suspected to be allergic to the patient. So if there is anything which can cause the patient which the patient is allergic to, we have to make sure that we take those things away because they may worsen their condition. Then also we are going to avoid the use of pillows made of lead or feather to avoid the patient reacting to them. So in short, we are making sure that the patient is not reacting to anything that we know of. If we are aware of anything that the patient is reacting to, which is causing the allergies, the inflammation to occur in the airways, we are going to remove those things. So in the environment also we want to make sure that the oxygen is there. Oxygen is there, is provided. Then provide humidification. The air should be dry. This can be achieved by steaming or use of cool vapor to protect against chilling the patient. So we are going to make sure that we provide humidification for air. Remember that the air which is the patient is breathing in has to be warm. It doesn't have to be cold. If it's cold, it is going to cause the condition to be worse. So then we are also going to keep the patient dry. Then also we are going to allow the patient to breathe comfortably, such as by propping her up, then providing a cardiac table with pillows for patient to rest on so as to improve lung expansion and a clear airway. So these are points that we have to provide or to consider when nursing our patient with asthma. So let's move on to look at the psychological care. So please note that in this presentation, we have combined the environment and the position. Remember, we've talked about which position that we should nurse this patient on. So let's move on to psychological care. It is very much important because this patient is frightened, they are anxious, they are fighting for air, so they are very much worried about their life. So it is important that as a nurse, you attend to this patient in a calm manner and reassuring this patient. And this is going to be achieved by doing the following. One, if you're writing your exams, remember to include yourself. You're going to say, I will explain the disease process. That is how the disease comes about, how the condition comes about, the signs and symptoms. So we are teaching the patient about their conditions so that they understand themselves better. So this is important to allay the patient anxiety because an informed person is able to cope well. So we are concerned about the psychological well-being of our patient. Then we are also going to explain what is being done and what is expected of her in simple language to win her confidence and gain cooperation. So in simple terms, we are going to explain every procedure that we do to the patient before performing that procedure to gain confidence and cooperation. Because if we don't explain what we are doing on the patient may not cooperate, and then it may make our work difficult and the condition may not be managed very well. So as a nurse also, we are going to make sure that you create a nurse-patient relationship to promote cooperation and allay anxiety. So this is in addition to that, we need to introduce yourself to the patient so that you create a nurse-patient relationship. Then also maintain emotional atmosphere in which the patient will feel comfortable to express their fears and feelings. So we have to create a conducive and a comfortable environment for our patients to be free to speak out about their worries, to ask questions where they are not clear, and so that we answer them in simple terms and that they understand their situations. Then when they ask us a question as a nurse, if you ask a patient a question by a patient, make sure that the answers should be answers as truthfully as possible. So those answers that you are unable to answer, you can defer them to the doctor or someone who can answer the questions well. So that is about psychological care. Another point which is important on psychological care is also involving the family members. So in this case, our patient is married, so we are going to involve the husband and the children in her care to prevent social isolation. Then, when it comes to observations, it is very much important that as a nurse, you are alert, you are observing the patient as close as possible. So we are going to monitor the vital signs. We'll check them every after 4 hours, or if the condition is very acute and severe, we are going to monitor the vitals according to how the doctor has prescribed or hourly. Yes. So we are going to observe the patient according to the condition or according to how the doctor has ordered. So check the vital signs as baseline data. So as the patient is just coming in, we are going to monitor the vitals, which will act as baseline data. We are going to monitor any deviation from normal. We'll check the pulse for features such as regularity, the strength, and the volume. So remember, when we are looking at signs and symptoms, we said the patient may have bradycardia. So it is important that we monitor the pulse. We check for respirations, also for frequency, for any difficulties in breathing or shallow breathing. Remember that this patient is having problems with their respiratory system, and therefore it's so very much important for us to monitor their respiratory system. Then also blood pressure is going to be monitored to notice if it's high or low, so that appropriate measures are taken. Temperature should also be evaluated for if it is raised, it will show that there is an infection. So it is important for us to also monitor temperature as well. So check for color of the skin, the mucous membranes, for cyanosis, pallor, and other abnormalities. So also observe for any cough, if there is phlegm or if the patient is producing sputum, we have to check for color, viscosity, blood stain, and report. So if the patient is coughing, we have to check the type of sputum mucus which is coming out. Is it blood stained? Is it clear? What color is it? So we should be able to observe these things and document and report if we notice any deviation from normal. For example, if there is blood in the mucus, we have to report to the doctor. So also want to observe the emotional status of the patient. So we said the patient is very frightened, they are very anxious. So we have to observe how the patient is responding to the condition, into the management. Then also we are going to make sure that we monitor oxygen saturation level using a pulse oximeter. If the patient is not connected to a cardiac monitor, we have to make sure that we are monitoring the oxygen saturation. This is so helpful because it will help us know if the patient is improving. For example, if they came with an abnormal low oxygen level in the body, when you are monitoring oxygen saturation, we'll be able to see if the patient is improving, if the oxygen levels are increasing, or not. This will be helpful to know what measures to take. So the next point is nutrition and fluids. So it is important that our patient is well, the patient's nutritional status is good, and the hydration level, the hydration status is also perfect. So we are going to make sure that we maintain hydration to help liquefy circulation for easy expectoration. So it is important that the patient is well hydrated. So having that in mind, the patient may be put on intravenous fluids such as normal saline or Ringer's lactate. So we have to replace the lost body fluids and electrolytes to maintain a normal homeostasis. So we have to make sure that so the importance of administering fluids also is that we have to prevent constipation. So if our patient is dehydrated, they may be constipated, which is so dangerous to this patient, because if they are going to be straining at opening bowels, or yes, when opening bowels, it will cause the condition to be very worse. So if the patient is unable to feed on herself, we have to insert a nasogastric tube for feeding. So we have to make sure that we serve small nutritious meals frequently to prevent respiratory embarrassment. So if the patient is not having enough food, they are not even having enough fluids, there is going to be respiratory problems, and it will affect the patient's recovery. So when the patient is commenced on IV fluids, if we are administering the fluids, we have to make sure that the fluids are charted or documented on a fluid balance chart. So a fluid balance chart should contain the name of the fluid, the type of fluid, the time that the fluid is commenced, the time or the duration that the fluid should flow, and then when the fluid is expected to end. And as we are administering these fluids, we should look out for fluid overload, because if we administer a lot of fluid in a shortest time, our patient can have fluid overload, which can also cause pulmonary edema, which can worsen the condition. So as a nurse, we have to make sure that we are alert for such complications. So maintain fluid balance chart input, and so maintain fluid input and output, which should be documented on the fluid balance chart, as we have said. So when it comes to hygiene, we want to make sure that during the acute phase, bed baths are avoided so as not to disturb the patient. So if the patient has just come, they're in acute severe attack, we want to avoid bathing the patient. So we don't want to make the condition worse. Then later, when the patient has stabilized, we can assist the patient with baths are given to promote self-esteem. Then when the patient has stabilized, we can do hair care so as to promote self-esteem, and we can help the patient look the way they want to look. So when it comes to rest and activity, we want to make sure that we minimize patient exhaustion and fatigue by anticipating patient needs and plan or care in such a way that we are not disturbing the patient. In other words, we are going to perform our nursing procedures in block or at once to give patient enough time to rest. Then also provide assistance in eating or drinking so as to reserve energy. So those things that we can help the patient with, we have to help them so that they reserve energy. Then also we want to make sure that only 2 visitors are allowed during visiting hour to allow the patient to have time to rest and recover accordingly. Then when it comes to elimination, ensure that the patient is not constipated. As we said earlier, constipation can affect patient's condition. It can prolong their recovery. So we want to make sure that our patient is not constipated, especially in an acute stage. This is because straining may worsen the dyspnea. And then also note the frequency, the color, and the amount of urine. So how much is the patient urinating? So if they are on fluids, if they are receiving intravenous fluids, we have to make sure that we are documenting even the amount of the urine that they are passing, the color and consistency. We have to do that. Then also note the movement. Is the patient going to the toilet? So we have to observe that and document accordingly. So when it comes to medication, administer medication as prescribed to relieve the attack. So remember, we looked at bronchodilators. And anti-inflammatory drugs. So all those drugs which have been prescribed, we have to administer them so that we promote the recovery of the patient. So oxygen to aid in breathing is usually administered, and it should be humidified. So the patient will be on oxygen. As we can see, we are also reassuring and encouraging our patients. So we'll also make sure that we are observing for the side effects of these drugs, or how the patient is responding to the drugs. So when it comes to IEC, you are going to encourage the patient to avoid overcrowding places and people with respiratory infections, because it will trigger the attack. Then the patient should obtain influenza and pneumococcal vaccines. Then we also teach the patient and relatives how to perform posture drainage and percussion to help the patient expectorate. So also we are going to teach the patient about coughing and deep breathing techniques to promote good ventilation and removal of secretions. Then also we are going to teach the patient about the importance of diet compliance, dosage, and side effects. Then also we are going to teach the patient on how to use an inhaler. So we are going to teach our patient how to use an inhaler as they administer their drugs such as salbutamol. Then we should also encourage the patient to report any reactions to drugs. We should also discourage the patient from smoking because it may trigger an attack. So she should avoid inhaled irritants to avoid triggering the attack. Then avoid strong perfumes, which may also cause attacks, and avoid areas where there is industrial pollution and exposure to coldness, because this may precipitate an attack. So the other part of the question was saying the patient is going to be on a nebulizer. So explain the use of the nebulizer and your role as a nurse. So let's look at the answers. So a nebulizer is attached to oxygen or air that converts a liquid into mist. So the medication is prescribed by the doctor along with the doses. So medication is checked and drawn up into a syringe and diluted with the prescribed normal saline, which can be 2 to 3 ml. If 2 medications are prescribed, they should not be mixed together. So separate nebulizers should be used. Okay, so this is a nebulizer. So what happens is the doctor will prescribe the medication, for example, maybe Ventolin or salbutamol. It will also, the dose will also contain the amount of normal saline you should dilute it with. So if, for example, the doctor says salbutamol 1:1, it means you get 1 ml of salbutamol with 1 ml of normal saline mixed together and put in this part of the nebulizer. Then this is connected to this. Then this nebulizer has a connection where you have to connect it or plug it to electricity. This is a mask which has to be connected to the patient's nose and mouth, and when it's switched on, this nebulizer will start working and the drugs will be forming a smoke like, which will be going through the patient's nose and mouth, and it will go down the respiratory system to do what it's supposed to do. So the equipment and the purpose of medication is explained to the patient. So you have to make sure that we explain what you are doing to the patient. The medication is put into a nebulizer which is assembled and attached to oxygen. So it's not at all times that the nebulizer will be attached to oxygen. For example, this one is not attached to oxygen. Yeah. So air is used instead of oxygen if the patient has got chronic obstructive airway disease because of the danger of disrupting his hypoxic drive. So sometimes it's not always that the nebulizer will be connected to the oxygen. So that's how it's going to be done. So that's how. So depending on how a nebulizer is, for this one you just have to connect it to the patient's nose and mouth and it will start working. So your part is to make sure that you are observing how it is working. Then the patient sits up in a comfortable position. So if there is oxygen which is being used, that will be done accordingly. So as a nurse, observe and ensure that there is fine vapor coming from the nebulizer and encourage the patient to breathe it in through the mouthpiece if possible. If it is too difficult for him, he may use an oxygen mask instead. So like our machine here has a mask, so the patient can use that. So at this point, a clean sputum container should also be ready. If the patient is coughing, they are able to cough up the mucus, they should be able to put it in the container and it can be taken to the laboratory for investigations. So the procedure is documented and the equipment is washed and dried and stored in a patient's locker until needed again. So at your own time, you can go through this so that you understand properly. I'm trying to be as fast as possible. So the other part of the question was saying, I think it's the last part of the question was saying, list or explain 5 points you would include in your IEC on discharge to the patient. So we are going to give information about their disease and its treatment and the importance of drug compliance. We are making sure that we are educating this patient on their condition. So teach how to use aerosol at home and demonstrate. So how to use we said earlier that we have to teach the patient how to use an inhaler and how to connect the drug and how to use it, and we have to demonstrate it. Then also they should keep themselves warm, especially in cold weather. So we also recognize and keep, the patient should be taught how to recognize and keep away from allergens such as foodstuff, pollen, etc., anything that can cause an attack. The patient should be avoiding such things. Then they should avoid over-the-counter medication which can complicate the condition. Then also teach the importance of early treatment for any respiratory infection, and teach about avoiding the use of pillows made of lead or feathers because this can cause an attack. So this is the end of our presentation, and this was the end of the question. So thank you so much for watching. I hope that this presentation is very helpful as you are preparing for your exam. Remember to study hard, revise well, and do all the best as you prepare for your exams. So if you have not yet subscribed to this channel, make sure that you subscribe, like, and share with friends this presentation. Thank you so much. See you in the next presentation.